We are going to take a look at the top 5 contagious viruses in the world. Starting at number 5 on our list. Lassa virus. The virus is transmitted by rodents. Cases can be endemic, which means the virus occurs in a specific region, such as in Western Africa, and can reoccur there at any time. Scientists assume that 15% of rodents in Western Africa carry the virus. Lassa fever is an acute viral hemorrhagic illness of 1 to 3 week duration. The Lassa virus is transmitted to humans via contact with food or household items contaminated with rodent urine or feces. Person-to-person infections and laboratory transmission can also occur, particularly in hospitals lacking adequate infection prevention and control measures. Symptoms: fever, general weakness, and malaise. After a few days, headache, sore throat, muscle pain, chest pain, nausea, vomiting, diarrhea, cough, and abdominal pain may follow. In severe cases, facial swelling, fluid in the lung cavity. The overall case fatality rate is 1%. Observed case fatality rate among patients hospitalized with severe cases of Lassa fever is 15%. Treatment: the antiviral drug ribavirin seems to be an effective treatment for Lassa fever if given early on in the course of clinical illness. Number 4. Avian influenza or bird flu refers to the disease caused by infection with avian influenza type A viruses. These viruses naturally spread among wild aquatic birds worldwide and can infect domestic poultry and other bird and animal species. Signs and symptoms. Bird flu virus infections in humans have ranged from no symptoms or mild illness, such as eye redness, and included fever, conjunctivitis, or mild flu-like upper respiratory symptoms, to severe, such as pneumonia requiring hospitalization. The mortality rate for humans with H5N1 is 60%. Since the first human H5N1 outbreak occurred in 1997. CDC currently recommends treatment as soon as possible with flu antiviral drugs for people who get sick with bird flu. Antiviral treatment works best when started as soon as symptoms begin. The United States federal government maintains a stockpile of vaccines, including vaccines against A, H5N1, and A, H7N9 bird flu viruses. Number 3. The Hantavirus. Describes several types of viruses. It is named after a river where American soldiers were first thought to have been infected with the hantavirus during the Korean War in 1950. Hantavirus pulmonary syndrome is a human disease found only in North and South America. Each strain of the hantavirus has a preferred rodent carrier. The deer mouse is the most common carrier of the virus in North America and Central America. In the United States, most of the infections occur in the states west of the Mississippi River. The time from infection with the hantavirus to the start of illness is usually about 2 to 3 weeks. Hantavirus pulmonary syndrome advances through 2 distinct stages. In the first stage, which can last for several days, the most common signs and symptoms are fever and chills, muscle aches, or pain headaches. As the disease progresses, it can lead to damaged lung tissues, fluid buildup in the lungs, and serious problems with lung and heart function. Signs and symptoms may include cough difficulty, breathing, low blood pressure, irregular heart rate. HPS can be fatal. It has a mortality rate of 38%. There is no specific treatment for hantavirus infection. However, if the virus is caught early and the patient receives medical care in an intensive care unit, ICU, they will likely improve. Sometimes antiviral drugs, such as ribavirin, are used to treat other strains of hantavirus and associated infections. Number 2. Ebola virus. There are 5 strains of the virus, each named after countries and regions in Africa: Zaire, Sudan, Thai Forest, Bundibugyo, and Reston. The Zaire Ebola virus is the deadliest, with a mortality rate of 90%. It is the strain currently spreading through Guinea, Sierra Leone, and Liberia, and beyond. Early on, Ebola can feel like the flu or other illnesses. Symptoms show up 2 to 21 days after infection and usually include high fever, headache, joint and muscle aches, sore throat, weakness, stomach pain, lack of appetite. As the disease gets worse, it causes bleeding inside the body, as well as from the eyes, ears, and nose. There are currently 2 treatments approved by the U.S. Food and Drug Administration, FDA, to treat EVD caused by the Ebola virus, species Zaire Ebola virus, in adults and children. The first drug approved in October 2020, Inmazeb trademark external icon, is a combination of 3 monoclonal antibodies. The second drug used is Ebanga. Number 1. Marburg virus, the most dangerous virus. It is named after a small and idyllic town on the Riverland, but that has nothing to do with the disease itself. The Marburg virus is a hemorrhagic fever virus. As with Ebola, the Marburg virus causes convulsions and bleeding of mucous membranes, skin, and organs. It has a fatality rate of 90%. After an incubation period of 2 to 21 days, symptom onset is sudden and marked by fever, chills, headache, and myalgia. Around the 5th day after the onset of symptoms, a maculopapular rash, most prominent on the trunk, chest, back, stomach, may occur. Nausea, vomiting, chest pain, a sore throat, abdominal pain, and diarrhea may appear. There is no specific treatment for Marburg virus disease. Supportive hospital therapy should be utilized, which includes balancing the patient's fluids and electrolytes, maintaining oxygen status and blood pressure, replacing lost blood and clotting factors, and treatment for any complicating infections. That completes our top 5. Thank you for watching.